The topic for today's practical is Widal test. Before coming to the main topic, let's discuss about some of the definitions. Serology. The scientific study of serum and other body fluids is called serology. It is used for the identification of antibodies in serum against infection. Antigen, it is a toxin or foreign substance when introduced in the body induces an immune response by the production of antibodies. And the antibodies are produced in response to an antigen or foreign body. Human serum contains about 5 types of different antibodies: IgG, IgM, IgA, IgD, and E. Now the precipitation test, it is the reaction between soluble antigen with its antibody, which is termed as precipitin, in the presence of electrolytes at suitable temperature 37 degrees Celsius and pH 7.4, resulting in antigen-antibody complex formation as an insoluble precipitate. So you can see here the antigen is in the insoluble form. When it reacts with the antibodies, it forms an antigen-antibody complex, which is insoluble precipitate. Then flocculation test, it is a precipitation reaction in which precipitates of antigen and antibody complex remain suspended as floccules instead of sedimentation. Now coming to the main topic, Widal test. This is a diagnostic test for typhoid fever, which has some other tests as well. For example, typhoid culture, the blood culture is a gold standard, immunochromatography, and PCR. So, enteric fever occurs when pathogenic microorganisms Salmonella typhi, Salmonella paratyphi, and its various forms infect human body. Body responds to this antigen by producing antibodies whose titer rises slowly in the early stages to a maximum and then falls slowly till it is undetectable. So normally the antibodies are detectable from the second week onwards. Widal test is less sensitive and it is not used nowadays because of its limitations. The limitations include this test is negative in the first week of the infection. As I told you that the antibodies are detected in the second week onwards. Vaccination and subclinical infections can affect antibodies. Reinfection may be difficult to diagnose, and patients of cirrhosis and hepatitis can also give false positive Widal test. Now the things that we need for the test, the reagents have all these antigens. As you can see, the antigens of the Salmonella and Salmonella typhi and paratyphi species. Then what is the principle? The main principle of this test is that if homologous antibody is present in the patient's serum, that means if the patient is already exposed to that antigen and the antibodies has been formed, then it will react with respective antigen in the reagent and gives visible clumping on the test card and agglutination in the tube. So we have two types of test, qualitative test as well as quantitative test. Specifically here we'll discuss about the quantitative test. So the first type is slide agglutination method. For this we need first of all the reagents, as I told you, and sample. The sample should be the serum at room temperature. And then we have this card which is specified for the slide agglutination method, which has some circles, and as mentioned, O means this is the antigen, the reagent antigen, or AH, again these are the circles for this antigen. Now, using a micropipette, deliver 80, 40, 20, 10 and 5 microliters of undiluted serum into a separate circle of slide test card. First step that we are going to do is that we are going to take the mentioned dilutions 80, 40, 20, 10 and 5 microliters of serum in all these circles, and again we are going to repeat it for these circles as well, which is specified for this antigen. Then we are going to add 1 drop of antigen into each circle. Then the next step is to add 1 drop of antigen, O in these circles and AH antigen in these circles. After that, mix the contents using separate sticks uniformly and spread over the entire area enclosed by a circle. Then what are we going to do? We are going to mix the contents. There comes with the sticks along with the kit of this test, and then the entire area of the circle is enclosed by mixing these reagents. Now rock the slide gently back and forth. Observe for agglutination macroscopically within 1 minute. The next step is that we have to rotate this card using our own hands so that the agents or the contents are mixed properly, and we have to do this for 1 minute, and after that we look for any agglutination macroscopically. And if agglutination occurs, we are going to see for the titer. What is titer? The serum titer is defined as the highest dilution showing positive result. As you can see here, these show some some agglutinations. This circle shows some agglutination, this circle also shows some agglutination. So this is supposed to be the titer, as this is the highest agglutination, while again you can see that there is less agglutination here. So this can be the highest titer. Okay. Coming on to the next test, that is tube agglutination test. So what we require in this test is 8 plastic tubes or glass tubes. As you can see that we have 8 plastic tubes which are named as 1 to 8 or glass tubes. And then the next step is take 1.9 ml of normal saline in the first tube and 1 ml of normal saline in the remaining tubes. So what are we going to do? That in the first tube we are going to take 1.9 ml of normal saline, while in the others we're going to put 1 microliter of normal saline using the micropipette. Okay. Then add 0.1 ml of serum in first tube and mix well, making it 1:20 dilution. So in the first tube, we are going to add 0.1 ml of the serum, the test serum that we have, and then we are going to mix it well. And then the next step is that the dilution that this tube becomes is 1:20. The next step is that we are going to take 1 ml of diluted serum taken from the tube 1 is transferred to tube 2 and mixed well. This is repeated for each tube till the 7th tube from which 1 microliter is extracted. So now after mixing this one, we're going to take 1 microliter of sample from this tube and transfer to the second one, and then we're going to mix this tube well, and the dilution for this tube becomes 1:40. And again we're going to repeat the same step, taking 1 microliter from this second tube and transferring to the next third tube, and the dilution for this becomes 1:80. In this way we're going to repeat the steps till the 7th tube, and you can see the dilutions as well that occurs. And taking out 1 microliter of sample from the 7th tube, we're not going to transfer it into the 8th tube, rather we are going to discard it because our 8th tube is the control. Okay, using micropipette, deliver a drop of antigen into 8 tubes and mix well. So the next step is that after making all these dilutions, we are going to put 1 drop of the antigen into all these tubes. It can be either an a O antigen or an AH antigen. Now, tube 8 serves as saline control. Incubate it at 37 degrees Celsius for overnight. And now the next step is that after adding the antigen, we're going to incubate this set of tubes at 37 degrees Celsius or at room temperature for about 18 hours, that is overnight. And then we're going to look for the agglutination again, for the signs of agglutination. The titer to be taken is the last tube to show agglutination and compare the results with the control. So why control is important? Positive and negative control sera are recommended to monitor the performance of procedure as well as compare pattern for better result. So and the titer again, as you can see here, that means again the agglutination is occurring in all of the 4 tubes. The dilutions 120, 140, 180 and 1/160. So we can see the highest agglutination in this tube, so this is supposed to be the titer. Now how do we report these tests? It is reported by giving the titer for both H antigen and O antigen antibodies. It is positive if the O antigen titer is more than 1:80. That means for O antigen, when we are looking for the O antigen test, the titer should be 1:80 or more. 1:160, 1:320 or this one. If it's less than this, that means the test is negative, and if it's this or above this, the test is supposed to be positive. While for the H antigen, titer should be more than 1:160. So for H antigen, this is the titer. If it's above this or this one, the test is going to be positive, while if the titer is less than this, the test is going to be negative. The antibodies titer is taken as highest dilution of serum in which agglutination occurs. Now, if no agglutination occurs, for test is reported as Salmonella typhi titer is less than 1:20. That means because this is the lowest dilution, so we can report it as the Salmonella typhi titer is less than 1:20. Now there can be false tests, a positive test as well, and the causes includes previous immunization with typhoid vaccine, repeated subclinical or past clinical infections, infection with malaria or Enterobacteriaceae class, healthy carrier of Salmonella typhi, patient of TB, endocarditis and chronic liver disease. So here again you can see the test. This is supposed to be one positive test in which you can see that the positive signs show agglutination. For O antigen, all these dilutions have shown some agglutination. So 1:80 is supposed to be the titer, and for O antigen as compared with the significant titer, which is 1:80, that means this is going to be positive. And H antigen, again, these are supposed to be the positive agglutinations, and the titer is this one, 1:160. And again, comparing it with the significant titer, that means it should be greater than 1:160, and again this is again positive. So this report is positive for typhoid fever. Now, tube method. In solution O-type antigen, after incubation, granular deposits can be seen if test is positive, while for H antigen, after incubation, loose cotton woolly clumps can be seen if the test is positive. So you have to draw these diagrams along with the text that is to be written on the practical notebooks. Thank you.